A mother will never forget how you treated her during pregnancy, during childbirth.
How emotional was it for you to go back to work while leaving your child in someone's care?
Most men till date don't know how to change a diaper.
I only play and feed the baby, and the rest everything is taken care by the Japa.
One of my ex-employee, who delivered a baby and who was about to return back to work, I asked, "Do you pump?" Just to make sure that the baby is fine. But then she got offended because I asked.
I
a
was going to
question.
say that. Why would you ask?
Hello and welcome to the XnY podcast on intentions, connections, and intimacy. Join me today, your host Suman Raju, with my co-host Dr. Bindu.
Hi.
Today we're going to talk about postpartum. Not just about the physical part, but the hormonal, the sexual, and the mind-wrecking mental component of postpartum. And today, in our episode, we have a very, very special guest. Special how? Special for three reasons. One, she's a good friend of mine, and I have known her for a very long time now. And two, she's a gynecologist herself. And three, she's a brand new mother. She's 3 months into her postpartum herself. And without much ado, let me introduce you to Dr. Manasa.
Thank you.
Hi, Dr. Manasa. Congratulations to you, and I'm so excited to have
Thank you so much. I'm excited to be here too.
Welcome to the XnY podcast, Dr. Manasa, and hearty congratulations on having a 3-month-old right now.
Thank you, Bindu.
And this is a conversation we are having not from a medical lens, but from somebody who is feeling it, experiencing it, and learning from her experiences each and every single day. To begin this one, Dr. Manasa, you have seen a lot of women go through pregnancies, postpartum, and you have held the rawest moments of deliveries. What still surprises you about the postpartum?
So it's been, let's say, 15 years since I've been caring for women in pregnancy, childbirth, and post delivery, right? But it wasn't until I became a mother myself that I actually understood the depth of this journey. So it's actually, in spite of all my medical knowledge, I had the same fears, the anxieties, and the apprehensions that any woman would. So I just feel like no matter, your titles, your credentials, bottom line, you are a woman in that situation, everybody's equal in the delivery room.
It's like a new journey. Even how much ever preparation you have, it's a journey of its own.
Nothing can fully prepare you for this.
But what was the biggest surprise that you had?
So it was the same thing, right? I always put this to my patients in a cricket example. So you watch cricket all the time. You know the rules, you know the game. If you watched it enough, you can even third umpire it on your screen.
Yes.
But when you have to go on the ground and play it yourself, so that's when your, thing comes out. So it was like that for me. So I am, training women how to hold your baby, how to breastfeed, what you should do to increase your milk production. All of these things I know. So I thought it should be easy for me. But yes, when I had to do it myself, it's again, I'm like on day one. I'm just born that day along with my baby.
Yeah.
So that's what it is. I was very surprised at that. I thought I would do better, but yeah.
When was the first shock that you had? On the first day
The
itself?
first day when the baby comes in your hand, no? That's it. Your brain shuts down and you forget all your obstetrics, gynecology, laparoscopic surgery. Everything is gone out of your mind. It's just like, okay, what do I do right now? So how does he latch? It's every mother, every baby is very different.
Okay.
So now generally, everybody would probably think in the society, "Ki it's okay, na? Inherently it will come to a woman."
Yeah.
But it's not like that. Every baby is different. Even a mother who has 2 or 3 children, right? With each baby, it's a different experience. One baby may latch wonderfully. One baby may not latch. There'll be a latching difficulty. One baby, there's adequate milk production. One baby, there's not. So it's each time it's a brand new thing.
So much of social conditioning, right? I mean, everything comes naturally to the mother and things like that.
Exactly.
But the struggle is real.
Yeah, the societal expectations from the women are unbelievable. It just adds on to a lot more stress to them.
Generally, the society celebrates the baby but forgets the mother.
Oh, yes.
And then how does a woman with this erasure of her identity, her libido, and her sense of self deal with it?
Yeah. So we all know, right? Every time a baby is born, the family is happy, everybody is happy. It's understandable that you are, just filled with joy. with the newborn. But in all of the celebration, the mother tends to get overlooked. That definitely happens. And at that point of time, with what the mother is going through hormonally, it can affect her feelings, it can affect her sense of self, like you said, right? So here she is in pain, and she's just taken a beating to deliver that baby, and the minute the baby is out, everyone's focus goes then. She's like just left alone. We actually see this in the delivery room on a daily basis. Husbands are trying to do their part. Things are getting better from the men point of view. They are staying there throughout the labor, but once the baby comes, that's it. They are like so excited, they just forget about the mother. And then the baby goes out to the family and everybody is just there celebrating. The mother is still here,
Left
she
alone.
still has after pains, she still has to deliver the placenta, she still has to go through the suturing, she's still in a lot of pain. So obviously, it starts bringing thoughts to her like, is this all I was meant for? Just to give them a baby? Do I not matter? So it's very natural human to think that way, especially when you have so much of hormones playing with you. It is bound to happen. It makes her sad. She's bound to feel low. Her sense of self is definitely affected.
What can a husband do in these times? I mean, apart from spending that extra time with the wife, but is there anything else that, when my wife delivered, generally she preferred to go to my in-laws' place or her parents' place.
Yeah,
So
another
all-
societal thing.
Yeah. So all I did was I went to the hospital. I said, "Oh, how cute, how nice!" And in that day, I was back home having a very good night's sleep. But I mean, spending time itself is a welcome thing. But anything else that you could expect from
See,
the
now
man?
when we talk about a father's role, right, men's role in childcare, there are many levels that we need to look at it from. The first level is again the societal expectations only. That there are gender-based roles. That women are supposed to do this and men are supposed to do this. That's like deeply rooted. So it's like childcare is a woman's job. So it's become that way over decades and generations. It's become like that. So you can't really blame the men just yet. Now they should start getting into it. But back what we saw from our parents, our grandparents, the fathers were not involved. It was, what do I say? There was that traditional masculinity. There was too much stigma in the society that, it's unmanly that if a man involves in childcare. So we need to first get that cultural shift.
Absolutely.
That is you have to deal with it from a deep rooted level, right? Then comes a man's awareness of to how to take about things when it comes to a child. Most men till date don't know how to change a diaper. Till date, including my own husband. So it's not rocket science, guys. There are two plasters, you just stick it on. That's it. So, so when even a woman doesn't know, right? Did the women learn about diaper changing in school? There's a separate class for women or what? No, right? So even the women, when she becomes pregnant, that's when she starts thinking about these things. So I'm going to be in this situation, how do I deal with this? I'm going to be in labor, how do I deal with that? So she starts talking to people, she starts talking to mothers, her mother, family, starts reading about things, takes prenatal lessons, postnatal lessons. So the same thing the husband should do. So be a part of the journey from the very beginning. What's happening during pregnancy, what's happening in the labor room, what's happening with the baby. If a man has the knowledge, he would be able to help much, much better. Otherwise, he might want to help, but he may not be able to do a good job at it. He might be there.
Yeah.
This reminds me, my friends, when they had the kids, they used to complain, "Ki, I want to sleep with my baby on the day." Like, but the family, the mother, like,
They wouldn't allow it.
they wouldn't allow. You will be disturbed.
father
your work
wasn't
is
allowed, you're
disturbed.
saying?
Yeah, the fathers want to do it sometimes, but the rest of the family says, "You have work tomorrow. You'll have to go to work. Let's do it." But the fathers themselves want to feel the thing and be there for the wife. There are couples like that too.
So this is what I meant when I said traditional masculinity and the gender roles. That, oh no, the man has to go to work the next morning, so he can't be tired. So obviously, see, we still haven't gotten there. It's going to be a long way. There is still maternity leaves. There's no paternity leaves.
I know.
There should be paternity leaves also. We are in a stage where we are still fighting for maternity leave.
Yes.
So when are we going to get that, and when are we going to get to the paternity leave part of it? Then it will come. The men will start involving automatically. So now it's understandable that they have to get up, run to work. So he can't do a night duty and then, you know,
No, but I think the times are slowly changing. Right
They
now, I
are,
think the man is
yes.
a lot more involved than what
Yes.
I've seen
Definitely.
my parents' generation.
Yes.
I was somewhere midway.
All of us. I think the millennials were all somewhere in the. I think millennials took a lot of beating in a lot of ways.
I agree.
So we are in that transition when it comes to anything.
Yeah.
Yeah.
So yeah, but it's getting better, definitely. I see in the consultation rooms, husbands are coming more. Earlier, it used to be just when I started practice 15 years ago, it used to be just be the pregnant woman with her mother.
Yeah.
During labor in the delivery room, the woman and the mother. Taking care of the baby, woman and the mother. Now, the husband is there all throughout. It's definitely changing, yeah.
You know, there is this reference that delivery is like a second puberty with all the hormones and the body changes and all of that. What would you like to comment on that?
You could compare childbirth to puberty in terms of the hormonal changes, like you said. But if I would compare puberty to a marathon, okay, so it takes a while. You have time to cope and improvise or whatever you want to do. Because in puberty, right, it takes months to years for the hormones to slowly start growing. And then first comes the telarchy, where for a woman there's a breast development. Then there's a pubarchy, where there's an axillary hair, pubic hair development. Then comes the menarche, where the girl has her first period.
Yes.
So this takes months to years. So her body has had the time to adjust and cope.
Evolve slowly.
Yeah. But when it comes to childbirth,
Sprint.
you are doing a 100-meter sprint. Okay. So it's the hormones just plummet just like that in a jiffy. So it's very hard. You are dealing, it's much more challenging to cope with that situation. Everything is changing physically, mentally, emotionally. That's, you could compare in terms of the hormonal change,
Yes.
but it's still way, way different. It's like 10x, 100x.
Yeah.
It added no sleep.
Essentially, both of them are running. One is like a marathon, the other one is like a sprint.
Exactly. So magnitude of the transformation is like way more in childbirth. Yeah.
Dr. Manasa, how soon is too soon to have sex after giving a birth?
So when it comes to sex after childbirth, right, there's no set time. Now, when we say what is too soon, nothing is too soon. If the woman is up for it, physically, mentally, emotionally, anytime is okay.
But how does this readiness look like?
So now the thing is, we usually medically advise ki wait for at least 4 to 6 weeks, because that much of time would be necessary for healing, for the stitches to heal, mental recovery, everything. 4 to 6 weeks is what. But if somebody wants to have sex before 4 to 6 weeks, we're not going to stop them. So that is okay. So, the readiness again depends on several other things. What is the mental state of her mind?
Absolutely.
First, the physical state, we talked about the healing. She has to fully heal. She has to feel like, okay, there's no pain. I'm not bleeding anymore. It's okay. Some people don't mind the bleeding. So each person, again, is different, right? But when it comes to the mental state of mind, that readiness won't come like overnight. It takes a while. So, and she should not worry about it. Like, what am I? There are many women who actually worry about it. I'm not getting physical with my husband. Is this going to distance him from me? And that kind of adds on to their many more worries they already have. So, I would suggest for such women, take it slow. If you're not ready, if you're not feeling it, it's all right. It's perfectly okay. Take it slow. Try to engage in other ways of intimacy first. Like, there's other ways, right? It doesn't have to always be a
The
penetrative
non-sexual.
sex.
Yeah, the non-sexual
Yeah,
intimacy.
so you can cuddle, you can talk, spend more time together when the baby is sleeping. So you can maybe go out on dates, whatever is possible. Just start with spending more time with the partner first. Talk about things. And then eventually you will get there. And sex will be the same like it was before childbirth.
Yeah.
But does the baby ever sleep?
Baby sleeps, baby is human. Yeah.
You just have to make time in between all of this chaos and, try to segregate
There's
and
that
have
saying
time for
that
yourself.
when the baby sleeps, the mother has to sleep. So there's actually no time.
It is true what you said. When the baby sleeps, the mother should sleep, because you're feeding the baby pretty much every 2 hourly to 3 hourly if you're lucky. Most women feed 2 hourly. So, and then the baby sleeps. When the baby is asleep, women tend to do other things. Okay, let me eat, let me take a shower, let me meet guests who are coming. A lot of time gets wasted. Do not entertain any of this. In the first 3 months, I would say baby sleeping, you sleep.
Yep.
That's it. But what happens is, now we may not be able to sleep like the baby sleeps. Like for my example only, I wanted to sleep when my baby was sleeping, but I couldn't because I've never slept in the day all my life. So we all are working professionals, right? Most women, they're not habituated to sleeping in the day. So suddenly you can't sleep just like that when the baby is sleeping, you're sleeping. It doesn't happen. So that's where you take help from others. You might want to sleep a little bit more in the nights. You might want at least that 4 hour, 5 hour window in the night. So you pump one feed. Give the job to your partner or somebody. Just this feed, can you take care of it so that I can get that 4 or 5 hours will work like magically for a new, postpartum mother. So, yeah, that's how you do it. But yes, almost as much as possible, whenever the baby is sleeping, try to sleep. Even if you're not falling deep asleep, just rest. You're physically, very exhausted. Just breastfeeding burns hundreds of calories, thousands of calories. You're like sitting in one chair and working out when you're feeding. So you need the rest.
Breast pump itself is not a common thing, I believe.
Lately, breast pumps are pretty common.
Okay.
And I what should I say? Breast pump is a blessing in disguise for working women, right? So once you've got past all of that problems of latching, milk production and everything, once you have the good milk flow coming, you can get back to work because you can pump. Leave your milk there. It's not like you're giving formula, so you don't have that guilt also. You're giving your own milk.
Yeah.
So it works wonderfully for working women.
And there are women who pump excess. If they have excess, they pump excess, and also they are doing the donation of
Yeah,
mother's milk. These
milk
days.
banks.
Milk banks.
One of my ex-employee, who delivered a baby and who was about to return back to work, I asked, "Do you pump?" Just to make sure that the baby is fine. But then she got offended because I asked
I
her
was going to
question.
say that. Why would you ask?
I don't know. I thought it was quite a natural thing,
No, this is one thing I want to tell everybody clear. Do not ask a, postpartum mother how she's feeding the baby.
I will have to note that down.
Yeah, in block fluorescent letters, because see, you don't know what the woman is going through. There are women who are having latching troubles. There are women who's not having any milk production no matter how much she's trying, and it's bad enough she's already going through all of this in her mind. She's already hormonally feeling like, I'm not being a good mother, I'm not doing enough for my baby, why isn't my body cooperating?
For all the mental reasons.
Exactly. And now when someone comes and asks, why are you giving formula? So imagine someone suddenly says, why are you pumping? Why are you giving formula? So that's it. So, she'll just like
Trigger is set.
one set of depressing causing hormones will start cropping up. So which is why I always tell, do not ask a postpartum mother what she's doing, how she's feeding. So yeah, I think the best thing to ask, how are you? How is your baby? Do you need any help? The best question you can ask a postpartum mother, do you need any help?
Coming back to intimacy again, birth trauma, how profound is the effect on intimacy? That the birth trauma, whether it's surgical or the natural way?
So birth trauma can be very devastating for a woman. So normally when a woman delivers vaginally, right, we give something called as an episiotomy, which is a deliberate cut we give to enable the, smooth delivery of the baby. But in spite of that, some women have tears. We call those perineal tears. And the vagina being so close to the anal opening, the tears can extend sometimes even all the way up to the rectum. So even passing stool motion can become very difficult. So imagine, forget about sex in this situation. Just passing urine and passing motion on a daily basis is causing a lot of pain. So you think a woman in this situation would even be thinking about sexual intercourse? It won't even occur to her mind. That's the last thing. So, and also there's this mental fear. Some women who have these kind of, birth trauma, they also have psychological trauma. They have PTSD. They're very scared to even wash themselves down there. They're scared to touch. And many of them have scars. Some scars can be very thick, very painful. So, it's very important to take help in this situation. First, communication with the partner. Second, seek sexual counseling. Meet the gynecologist. We'll probably examine you down there. If you need some gels to soften the scar, right? So that a scar won't stretch as much as a normal skin down there would stretch. So they might need laser therapies in case there's a keloid scar, anything to make the area a little bit softer and smoother so she doesn't get pain. Some women even have dyspareunia, what we call painful sex. Everything is looking okay down there, but there's painful intercourse. So again, there, again, the psychosexual counseling comes in play. They could use lubricants. They could try different positions where you're not putting too much pressure on the scar. So, you have to seek help in this situation. But again, most women with birth trauma also, they take a longer time, longer healing, but they eventually do get back to intercourse. So that happens.
But this is a phrase I keep listening when the woman who gave birth say, I don't feel sexy anymore. How does the woman navigate her sexual journey post delivery, even if it's after 1 year, when their bodies feel strange?
So, see, right, after childbirth, there is a lot of changes in her body.
Yes.
There's a change in the body shape. She is added weight. On top of that, there's a belly hanging. And, even breasts, which are normally a very erogenous part of, intimacy and sexual intercourse, breasts are also not feeling erogenous anymore because they're filled with milk. And every time she has an orgasm, milk starts leaking. So, she might not, if somebody's like okay with it, it's fine. But there are very few women who are okay with it. Many feel non-sexy. And coming to the vaginal part, she's probably still bleeding. Even after the bleeding stops, they have vaginal discharge. And if she's had a natural vaginal birth, there is vaginal looseness also.
Yes.
So she's worrying about all these things. Will my partner be satisfied with the vaginal looseness? All of this definitely makes her not feel sexy. But that's where, again, taking help, doing pelvic floor, physiotherapy,
Exercises.
pelvic floor exercises, pelvic floor physiotherapy, all of this will help get her gentle exercises, walking, yoga. All of this will eventually come. She needs to be mindful about her body, that, tell herself that it's okay that I feel this way. I just had a baby. So this is going to happen. So it's fine. I don't need to feel bad about it. If she's not doing it, people around her should do it. That it's fine. The partner should say, you look absolutely sexy. You're the most sexy mama I've seen. So, it just gives a burst of happy hormones in her mind. All of that will help her come back to normal very fast.
So that should be the go-to strategy.
Yeah, the
Yes.
fathers have to say,
Yes.
keep talking to the wife that she's good and sexy.
Yes. No, even if you say, when are you going to lose all this weight you gained? So he might be saying this out of concern.
I know.
But it's going to trigger a lot of thoughts in her mind. So probably the man doesn't mean anything bad, but
You did mention about the go-to strategy for a couple. What would be a go-to strategy to the woman, to the new mother, so that she can connect with herself physically, sexually, and even spiritually?
So see, this is a process, and many may not like what I'm going to say because they won't really have the time to do all the things I'm asking them to do. Physically, to connect your body again, you have to start with some gentle exercises. So there's no alternative to it, unfortunately. Even be it just by the side of your bed, you're just doing some stretches. That'll also have a lot of impact. So start with some gentle exercises, walking, yoga. You can maybe take your baby out for a stroll, whatever it might be. It's going to help a lot to connect physically. Especially, pelvic floor exercises also. They have to recover not just in the body, they have to recover down there.
I know.
Yeah.
So, with the belly, they might have to do some, exercises to tone out those muscles again. Because once these things start happening, right, they start feeling better about themselves. So, it's very important they start with these exercises. Yoga, if nothing else. Yoga, you can just do in your house, maybe with a screen, right there with your baby. So, yoga will help. Breathing exercises will help. If you're just holding the baby's feeding, sit and do the exercises. So, these are very important to connect physically. When it comes to connecting sensually, right, then that's where your self-love starts. So you have to maybe take hot baths, go for massages, you have to start loving yourself more. Maybe go for a salon visit, whatever it might be. That'll just help boost your happy hormones again. So now spiritually, when we're talking about, it depends again from person to person because every person's spiritual perspective is very different. So you can listen to music. It actually helps for some, like kind of a meditation. You could listen to devotional songs if you're someone into that. It actually calms a lot of people. So this is what will help. A woman should start doing all of these things. Start as early as you can. Immediately once you're out of pain, right? Once there's no more pain, you can immediately start all of these things. There's no medical, clinical reason why you shouldn't do all of this. So that'll help her get back to feeling like herself again. Both physically, mentally, emotionally, every way.
But I have read somewhere that the new mom went back to exercising, that to high intensity within like 15-20 days because she wants to get back into her figure. Do you encourage something like that, or do you tell the moms to just take
Absolutely
a
not.
step back?
That's why I particularly mentioned gentle exercises. So you need to save your calories for breast milk production. You don't have that many calories to produce milk on one side, to do high intensity exercises on the other. You have the time to deal with that part later. You don't have to address your tummy muscles immediately after childbirth. Most part of, that muscle recovery comes with its own recoil. After delivery, you've stretched out a rubber band. Now you've relaxed it. It's going to go back on its own to some extent.
Give it time.
Give it time. Then eventually, once you are maybe weaning off your baby, once the breastfeeding is, reducing, your energy levels start improving a little bit more. Once you start solid foods for your baby, right? Your baby is not depending on your breast milk so much. So few feeds of breast milk only. So more energy to do other things. So that's when you can start a little bit of maybe high intensity. But I wouldn't advise abs or core exercises for at least, a year after a cesarean delivery. If you've had a normal delivery, you can do it. Vaginal delivery, that is. For a cesarean, I would say at least wait a year. Otherwise, you would be, disturbing the stitches inside or triggering a hernia probably.
I know.
So that wouldn't be a good idea.
I would say, mothers, please be mindful. Talk to your gynecologist before you jump into any of these high intensities and want to go back to your personality.
It's
again.
good that they're thinking that way, that they want to be fit and do things, but there's a way to do it right.
Not so aggressively.
Yes.
Let's talk a little about mood disorders. Postpartum, there's anger, there's depression, and there's this rage for whatever reason. Anything from your experience that you like to talk about?
See, when we talk about postpartum mood disorders, the commonest mood disorder we see is baby blues. It's called baby blues. Many women are actually aware of this term. So, baby blues are experienced by 80 to 85% of, we're talking about nearly everyone.
Yeah.
Everyone who's had a baby can have baby blues. Now, baby blues are usually subtle, mild symptoms where they probably have crying for no reason. Why is this cup like this? Why isn't it like this? They might get affected by even that. So they tend to cry a lot and they're kind of restless. Even when they're sleeping, they're thinking about what the baby is doing. So they're not even sleeping peacefully. So all this can happen. It's very natural. Our body was designed that way so that the mother actually thinks more about the baby. So this can be avoided with, again, a lot of, well-supported environment in the house, nutritious diet, supportive partner, a lot of love, in the room. So that can help deal with these baby blues, basically. And they usually go off within the first 2 or 3 weeks because the hormones start to level out after 2 or 3 weeks. So they start feeling better. But like I said, if the surroundings are not, like they should be, then it can worsen. So the next mood disorder would be postpartum depression.
Okay.
Nobody will have to go through this if the things are taken care of well. So now when that happens, anxiety, a lot more anxiety. What happens in baby blues is very mild limits. So depression, thinking about very intrusive thoughts, sometimes depression is so bad, they even think about harming the baby. They're like, what? I can't take care of this baby anymore. When does this happen? When she's not getting help.
The rage is directed towards the baby.
Exactly. So depression doesn't technically have to be always depression. That's another thing I wanted to specify. Because it doesn't mean being sadness only. It can be rage, like you said. It can be harmful to the baby and all of this. So that's when you have to seek help. For this, again, the mother should be mindful. She should know first now what she's feeling so that she can seek help. If she's not able to realize that she's thinking this way, that's where the others come in the family, the partner, the family. They have to see, okay, she is being too anxious. She's being too sad. So let me take her. So that's where help should come in first.
I think that's really helpful when you said the first 2 to 3 months, which is extremely important.
Yeah. 2 to 3 weeks is where baby blues are common, and then it settles
2
down.
to 3 weeks.
Yeah, 2 to 3 weeks. If that period goes well, you have almost always avoided postpartum depression. You can completely get it out of the picture.
That's nice.
Yeah.
If somebody goes into this anxiousness or paranoia, when do they seek professional help?
Immediately. That's what I said. She may not realize first. If she realizes, it's well and good. That's why I said all mothers should practice that mindfulness. Be mindful about your body. Be mindful about your thoughts. Be mindful about everything you're doing. So watch yourself, basically. So check yourself before you wreck yourself. So this is a very common thing, right? It's very important. So yeah, but if they're seeing Anything happening, going out of the way here and there, seek help early. What is the harm?
But when all of this is there, this hormones also, we try to think a lot. But does this oxytocin, non-sexual intimacy style, help in increase the bond and then not push the mother into being mood disorders?
The touch, the affection,
The
and
touch,
the
affection and
other
the-
Yeah.
components
So
of
when we
it.
talk about touch, affection, and this, right, oxytocin, there's something called as TLC. Many people must have heard. It's tender, loving care. TLC is the best medicine you can give a, nursing mother. So it works as good as any medicine. It promotes healing, it relieves pain, it reduces complications like infections, it elevates mood. So you are avoiding all your mood disorders there. So just TLC does a lot of wonders.
It's the magic.
Yeah.
The magic
That's
pill.
why in one word, if you want to tell, what does a new mom need? Tender, loving care. TLC.
Not just for
That's
the baby, but for the mom too.
Yeah, baby will anyway get because it's so super cute. They'll get from everybody. It's the mom that needs.
So when we are talking about this tender loving care, what is other than the food and sleep that we can give it to a new mom?
Help. Help is something that you have to give. It just is best. Because, see, a mother will never forget how you treated her during pregnancy, during childbirth. If you have done anything nice to the women, be it you've said something nice, you've done something nice, you've just offered a small helping hand, that's it. You'll be close to her heart forever. So, help is something. No fruits required, no dry fruits required, just help.
For men, it is through the tummy, but for the woman, it is help that keeps you bonded.
Yeah. So, food for men, help for women.
While you were mentioning earlier about the massage, I remember my wife saying, post-delivery, that while the child gets all the massages, I wish somebody gives me a massage once in a while. So I think that also comes into the tender, loving care.
Why not? Yeah, mother should get massage, na? Why not? Because see, during labor, it's not just if she had a vaginal delivery, it's not just the area down below. She's literally taken a beating, like I said.
Soreness.
Coming out of the labor room is like coming out of a boxing ring. You've taken a lot of beating. You're sore all over. You're exhausted. So a massage can help in a lot of ways. Because when anyone is getting a massage, right, you're improving the blood circulation. So it helps maintain her blood pressure also. So, and again, the pain relief. What more does she need immediately after childbirth? Yes, massages help a lot. It actually helps improve appetite also. It boosts milk supply, boosts happy hormones,
Yeah.
endorphins.
Yeah.
Massage is like an exercise which you're doing just lying on a table because your muscles are still working. Your muscles are working while somebody is massaging you.
Yes.
So, yes, you still have those happy hormones, endorphins.
I'm curious. There is this thing these days, the Japa technique.
Japa.
Japa.
So I heard a friend say that I only play and feed the baby, and the rest everything is taken care by the Japa.
No.
What does this do to the bonding?
If the Japa could do everything, there wouldn't be any mood disorders. There wouldn't be anything, absolutely. See, Japas are, for those who don't know what Japas are actually trained baby caretakers. So, but they are not trained by doctors or, someone who has, professionals. So they're just experienced in baby care. So Japas are very helpful. If you can afford one, please get one. Because, see, now the mother's feeding. Feeding takes about, say, 20 minutes, sometimes goes up to 30 minutes. After that, if you have a Japa knows how to burp the baby. Japa knows how to put the baby to sleep. Japa knows how to give a nice, relaxing bath. They know how to massage the baby right. If someone in the family is trying to do all these things, they might be wanting to help, but they may not know how exactly to do it. And then the mother is anxious. Oh, someone's massaging the baby. Are they doing it right? Is my baby getting hurt? But when you have a trained person, an experienced person doing it, right, you can be a lot more relaxed. So Japas are good. But again, see, whenever we hire domestic help, right, there's always those issues. Is she good? What is she like? Is she going to leave? Will she take long leaves?
Somebody trustworthy is good.
Yes, a trusted caregiver. Japa, if you get a good one, yes. There are many newer Japas also who are, probably just starting their career and may not be so up to the mark. But yes, most of them are good.
But I would still say have the help with you, have the japa with you, but also try to do that touch and all, because when we tell a new mom, we say baby to body touch is very important. That creates the bond. Leaving everything to japa and just being there is also not the
Yeah,
right
you
thing to do.
cannot leave because, see, baby again wants the mother. Japa can't, again, like I said, do everything. So you are feeding, but unless you are holding your baby more, maybe the baby, sleeps next to you, being closer to the baby, that body to body touch, that kangaroo mother care, all of that helps boost milk supply also. Only when the mother spends time with the baby, that, hormones come and milk production happens.
Also, the bond. Does it affect the bond between the mother and the child? I mean, when
Yeah.
you have a lot of skin to skin
Yes,
contact.
yes, definitely. And this bond thing is not just for the mothers. Skin to skin definitely helps with the bond, but even for the fathers.
Absolutely.
So when couples ask me about what to pack in the hospital bag, for men I always tell pack a loose t-shirt, because when the baby is born, right, the mother is lying in pain post delivery 2 days. The men can give the kangaroo care. That actually helps with the bond between the father and the baby also. So kangaroo care is always good. It helps the mother. And see, you cannot really, make the japa do everything. Because she is a human too. She can't. It just doesn't happen that way. So you get, let's say, maybe, 60-40% if you have a very good japa. You're feeding the baby. The baby wants to be put to sleep by you. Sometimes if the baby is agitated, they want to be put to sleep. A japa cannot. Baby wants you again.
The calmness a mother can bring.
Exactly. So babies can't see clearly. Newborns can't see clearly in the first 2 weeks. It's just black and white blur. So, but they can sense who the mother is, because they can smell the mother and they recognize the sound of the mother. They've been listening to the mother's voice from when they were inside the tummy. So they know who the mother is. Next is the father. They recognize the father's voice also from when they are inside the tummy. So the first is mom, second dad, then comes anyone else. So if the japa is not able to put the baby to sleep, you will have to take over. And there are many, many situations like this where you will have to take over. Now, but I would still say japas are useful because you're on the bed. You need things. Get me that, get me this. Baby's here, baby's crying. I need a burp cloth. I need this. You need.
Use it as a
Who's gonna-
supplement, not a replacement.
Yeah, you might have parents, mothers, in-laws, right? But see, back in the day, the age difference between mothers and grandmothers was very less. So they were fit enough to run around, do everything. But now it's not the same thing.
I know.
My patients are like, the mothers are not able to do. They're not able to run around. They're old, yeah, come on. You can't, expect them to take care of a newborn, which is hard work. So you need help.
A lot of it has changed over the years also. These days, I think I've seen friends being asked to get a shot before they come to see the baby.
Short of what?
Shot of pneumonia vaccines and all of these vaccines.
That's paranoia.
Yeah, borderline. So, see, we give flu shots to pregnant women. See, everybody should take flu shots every year because we are having so many different kinds of flus coming up. So, it is important you take that. So, annually, if everybody is taking their regular flu shot, then you don't need to do all this extra. In pregnancy, we give the mother a flu shot. But if the father hasn't taken in the past 1 year, it's better he also takes.
Okay.
So, because mostly it's the mom and dad getting exposed to the baby, right? Now, here I want to add one more thing. Best is to avoid too many visitors.
Yes.
Avoid too many visitors in the first 3 months. Baby's immunity is very, very low. They don't have a developed immune system yet. So, anyone who comes, you can't tell them no. They want to hold the baby, they want to kiss the baby. Now, kissing, I have to talk about kissing a newborn baby. Please do not do it. I would say at least until 6 months, please hold on to your feelings. Do not kiss a baby. We've had babies get herpes infections, severe viral infections, just because someone kissed the baby. And they may not be aware that they have the herpes simplex virus, right? That is spread through saliva. So it's a small, vesicle on the lip. They might think it's a pimple, but when they kiss the baby, they're transferring the virus to them.
Yes.
Do not kiss a baby up until 6 months of age at least. Okay? If you even longer would be even better. But yeah, maybe after that you can give the baby's feet to kiss or something.
I think a good trick would be, probably introduce the baby over a Zoom call or a Google Meets.
Now that you said Zoom call and Google Meet, I want to tell you my personal experience in this.
That's what we
So
wanted.
I actually stopped visitors the first 3 months. It was an absolute no. And my husband did a wonderful job. He was like the DCP of the household. Like no visitors. Absolutely. But during this time, the family members are not going to keep quiet. They want to see the baby. Like, okay, let me do a video call. Let me see. So with the video calls, right, my son has now learnt about this bright screen and things moving about in that screen. It is obviously very stimulating for their young brains. So now every time I'm doing a video call, in case I want to talk to the person and I turn the phone towards me, he's doing he wants to look at the screen again. So I've now stopped video calls. This is something I've learned from my personal experience. Because we're always talking about, no screen time, no iPads and whatever, desktops or TVs. But nobody told me about this video calls.
Yeah.
This was another screen, which, it didn't strike me.
I know.
So yeah, any screen is a screen. Yeah.
I know that you have going back to work right now. How emotional was it for you to go back to work while leaving your child in someone's care?
So, see, this can be done smoothly if you do it right. So, going to work comes with a lot of guilt for everybody. So, even dads, right? My husband feels guilty when he has to leave the baby and go to office. He's like, "Ayo, I'm missing him." So, you need to deal with that guilt in a nicer way. Spend more time with the baby when you're at home. So, working hours apart from those, when you're at home, right? Spend, even if you have a japa, spend more time.
As much time as possible.
So you will not feel so bad then. Especially the baby's wake windows, right? When the baby is awake, they have those play times. They're not sleeping and just drinking milk and sleeping 24 hours. So they have those wake windows. During the wake windows, spend more time. So baby's looking at you, baby knows you, baby recognizes you. Then when you come back from work, baby smiles at you. You won't feel so bad. So if you're not doing that, if you're just being with the baby when the baby's sleeping, then they don't remember your face, especially if the gap becomes too long. Along with this, there are two more things you need to do. Coming to work, pick flexible, working arrangements.
Flexible
Yeah.
shifts.
Yeah, and also take help from some supportive colleagues or somebody. Very important in terms of work, because you're running back to feed, you will need help from colleagues. And one most important thing, the transition time, right? Let's say you want to go back to work next month onwards. So from this month only, you have to start the preparation. So make a schedule for your baby, like a kind of routine. Like, okay, this time my baby is feeding, so he's going to sleep at this time. Then he wakes up again at this time. So like I made it I wanted to work 9 to 2. That's the common time where we have most consultations, right? And surgeries also I start first in the morning. So 9 to 2 I wanted to work. So I made sure his milk time is in the morning before I go. And then I pump one feed. My baby usually drinks every 3 hours, which is good, but not everybody is like that. Some women have to pump more and maybe keep it, for 2 feeds ready. So when I come back, again, it's time for the next feed. So if you make your baby get used to this routine.
Plan ahead.
Exactly. So then it'll be a much smoother transition and you won't be that stressed when you're working.
Tell us about the biggest myths that you've seen in postpartum.
Myths, there are hundreds and thousands of them, and all myths are big.
Yeah.
But we would be talking the entire day if we talk about, postpartum myths. But I want to address maybe two most important ones. First, and the worst one, water intake. Most new moms are prevented from drinking water because apparently it causes weight gain. Okay, or I don't know what else it's causing. There are many stories around that. But imagine what not taking water can do to a healing mother, right? She's just had a lot of blood loss. So she needs the hydration. She needs to maintain her blood pressure. And most importantly, she needs to be hydrated to produce breast milk. Milk contains 80-85% of water, right? So if she's dehydrated, where is it going to come from? So water intake is very, very important. And especially with the, bladder control issues also are there. So if they're hydrating well and if they're passing urine more frequently, your bladder is also starting to recover slowly. So overall, water is like, what do you call it?
Elixir.
Elixir, yeah. So it's like that for postpartum mothers.
Yeah.
Hydration, ladies, drink up a lot of water, as much as you can. Be it fruit juices, coconut water, whatever it might be. Hydrate well.
Yeah.
The more the body weight, the more the water intake.
I remember when my wife delivered, she used to count the liters that she's drinking, and they used to restrict her, saying that you drink beyond that, there's likelihood that you might catch cold, so don't drink too much. I didn't have a say in it at all.
You should have had a say in it. You should have scolded all of them. Because, see, water, what is water going to do? If you drink in excess, it's just going to come out in urine.
Yeah, I know.
what is it going to do?
Yeah.
And it washes out all the toxins in the process. The more you drink, the more it's going to wash out.
Flushing out.
Exactly. So it is very healthy. This shouldn't happen actually. It's just very, very disappointing that water is being restricted
Do you still hear that in your OPD?
every day. Every day. And a lot more of crazy myths. That's the reason why we're doing all these, right? Our podcasts, our social media, anything we're trying to do on social media is to educate only. They're making fun of doctors nowadays, Doctors are not curing anymore. They are dancing on reels. If we are making reels, even if it helps one single person, it's worthy
worth
of our time. Because there are so many other quacks doing so many things, saying so many things. They get lakhs of views. I don't get any views. I'm telling important things. So it's just the way it is, unfortunately. But it'll get better.
This reminds me when I was one of my friends married very young and she had a baby. She was not fed anything other than bread and milk for 3 months, and she's a feeding her. And then I was doing MBBS back then. So I can't say something, and the auntie was like, no, it is like that only. You can't eat that. You can't eat it. Like,
This was the
what?
second myth I wanted to talk about. I said two important. One was water, one was food. Obviously, what else do we need to live, right?
Yeah.
So bread and milk thing is there. It's still happening. They are feeding only bread and nothing else. So I'll tell you about bread. So they're using white bread. So white bread contains like low calories, easy calories. It even contains a lot of sugar. So women get that extra calories, and it does help in milk production. But it doesn't mean you will only eat bread. You need your whole grain nutritious food also. Right? So back in the day when women were kind of undernourished or some even malnourished, right? For them, this loose calories and quick sugar used to help for breast milk. But now it's not the case. You're not that desperate. You have so much more nutritious food so easily available. So you should eat everything. And one more thing bread does, constipation. Bread doesn't digest so easily. We are all genetically, made
meant to digest the
eat
bread.
rice and wheat, right? This bread is Western food. Their guts are habituated to it in terms of genetically. Ours are not. So a lot of constipation in these women. And to add with it, milk. One more myth is there. If you drink milk, you will get milk. That's rubbish. To make milk, you need to eat a balanced diet. You need to have your 30% of carbs. That's your rice and wheat. You need to have your 30% of protein. All your dals, rajma chanas, meat, eggs, everything. 30% of fruits and veggies, which is fiber. And that 10% of fats, which is ghee. Healthiest homemade ghee. So that should be your balanced diet. You don't need to do anything extra. So when it comes to food, right, if you want to add something, you don't need to remove anything from our routine natural diet, traditionally what we have been eating. If you want to add something, you need to add galactogog foods. Like galactogogs are foods that increase milk supply. So there are only 2 or 3 of these which are very important. Garlic, moringa, and for some women, non-veg. A lot of calories, right? Mutton, lot of calories. So you can add galactogog food. You don't need to remove anything from a woman's regular diet. So yeah, and no only bread and milk. There are some families who do only idli. Just idli, all 3 meals. That's it, postpartum depression. Yeah, women are crying in the consultation rooms. Doctor, they're just giving me idli. So it's just very disappointing. So eat up.
Sneak out on the way to the hospital, maybe?
I actually tell husbands to do this. I'm saying it in front of camera. In the hospital also, right? The hospital is giving you 3 meals. And obviously, it's meant for patients, so it's kind of bland. And not everybody likes it. But a breastfeeding mother needs a lot of extra calories. So I always tell them, smuggle food. It's not allowed, but do it, Baba. I did it.
Do we need to chop this out?
No, it's okay. It's okay. At least, carry those snacks. Snacks are allowed, right? You can carry snacks. I would suggest dry fruit chikkis, lot of quick calories. Gond laddus, lot of quick calories, helps in, breast milk production. So you need to carry food. Just those 3 meals like everybody is eating will not be enough for a new mom who's trying to breastfeed.
I know this is funny, but do you succumb to such pressures from family and expectations?
Society, family.
No, I'm a big rowdy. I don't succumb to anything. Lot of people tell me, see, my side of the family is all doctors. So from my side, usually nothing much comes. But my husband's side, even my husband is not a doctor. But he knows I know my stuff, so he doesn't say anything. But when it comes to his, family, extended family, they all tell me things. Why are you not putting oil on the baby's hair? It's not necessary. You don't need to put oil on the baby's hair. I usually give a massage 20 minutes before the shower, and I apply oil, give a proper oil massage, and then I wash it off. If you leave on oil for too long, right, it's cold. More heat loss happens. It's liquid, right? So, not as much as water, but yes, oil still, there is heat loss. So, anyone tells me something, I actually sit them down and I tell them, what is the logic? Why are you telling me this? I actually tell them, no, this isn't right. This is the actually right thing. Some people take offense, let them. So, but it's important they learn because they're not just telling me, they're probably telling so many others also. So, yeah, I don't succumb.
It's always better to, give a reasoning of this unscientific
Yeah.
rituals.
Sometimes if I don't have energy to explain, especially in the first 2 or 3 months, I didn't have the energy. I'll be like, done, okay. I would just say that, yes, I'm doing exactly what you said. And then I would just like forget it. In the next
Mother, you
minute.
should do this, but ask your gynaec or a pediatrician on what to do and then follow the scientific advice.
And the most important thing women should do, don't get stressed with it. There are so many patients who come back after delivery and say, Doctor, so many people are telling so many things. I feel like I'm not doing everything. You cannot do everything. They will tell hundreds and thousands of things. You can't. And the mother knows best what to do with her child.
And there are too many contradicting things also.
Yeah.
A says something else and B says something else.
Yeah, you don't have to listen to everything and get stressed.
So there's this question I ask a lot of my doctor friends, and especially a gynecologist. What do you do to dissociate yourself from all the scary things that you hear in your OPD?
Nothing scares us as much because I usually explain to them, like I said, if they come up with some crazy myth like this, it does kind of irk me a little bit, but then I tell them, see, this is what it is. Sometimes I tell them, when you're coming for your next visit, bring the person who said this. It's usually the mother or the mother-in-law. So I tell them, bring them along so I can explain to them also. So that gets happened. But dissociating myself, once I'm in the hospital, right, I kind of forget my life. Everything gets left outside. This happens with most doctors, especially for surgeons, right? When we are in the operating theater, you just forget everything. I forget my baby. You can judge me all you want. I forget what's happening at home. When I'm in the OPD, it's a different thing. I have the monitor right there. Between my consultations, I'm looking what the baby is doing. That's fine. But when I'm in the theater, operating theater, right, you actually forget. So surgery is like a kind of meditation for me because I love it so much. So that was the whole reason why I became one, because I enjoy it. So once I'm there, you're in it, you're doing something, you just completely forget. So it's one way to dissociate. Once I started working, right, I'm stressing a lot less about my baby stuff. And my baby is doing good. So maybe I was overthinking certain things before, but now I have that sense of calm. And
You come out from all of the work, sit at home, and the baby, you only think about it. So when now you're back at work, you have many else, and
So OT is your sanctum sanctorium.
OT is definitely my sanctum. Even if let's say I've had a fight with my husband, right? I go operate and I come back and I've forgotten that fight. And I'm like,
By the way,
talking
what
about-
are we fighting for? I don't remember.
I don't even remember to say that. I'll be like, okay, what are we eating? It just becomes that much normal. So, yeah, and I'm sure everybody has their own zone like this. It's just best to keep getting in there and coming out frequently.
You just given him a hint. Whenever there's a fight, you just कुछ surgeries है क्या schedule कर दो.
We are way too mature. We got married so late in life, yeah. We don't even fight that much. But even if there's something to discuss also, I forget. Yeah, so it's like that.
So we have some questions that our viewers have written to us over the social media handles. I like to ask you these questions that they would like to get answers for. So there's this lady who says, is it normal that I hate my partner right now after delivery?
I wouldn't use the word hate. Even the woman probably doesn't hate, but she doesn't know how else to say it, so she's using the word hate. Right now, they just feel a little disconnected towards them because of whatever we discussed. She's physically going through a lot of things, mentally going through a lot of things, and there's a baby in the hand. So all of your focus, 100, 200% is on the baby. Yeah. Whatever love you have is going for the baby. So you may not have much left for the others, including your partner. So, they do tend to think that, I have distanced myself so much without realizing only that distance comes. Because just days and weeks pass by taking care of the baby. You don't realize how much you probably haven't even spoken to your husband in the longest time. So that's when they start thinking like this. What happened? Did I like forget what we were before? So, but it's good to address it. The moment she realizes, it's better to address it soon. Like I said, non-sexual intimacy, spending time, going on dates, do those things. It's fine. And the husband also plays a role here. They need to also understand that it's okay if my wife is not, tending to my emotional needs right now. So it's fine because she's taking care of my baby. So if that understanding is there, perfect. No need to worry about it.
Actually, a lot of men don't really understand what goes with a woman when it comes to hormones and all of that. I mean, after these podcasts, I've been a little more observant as to what is happening with the moods and all of that. Yeah, so there's another question which says that why do I feel, the lady says, why do I feel touched out but also lonely?
See, she's sore, right? And that soreness can last for days to weeks sometimes. So even if somebody, even if let's say the partner is trying to give a hug, she tends to be a little bit aversive to it. That can happen because she's having bleeding, vaginal discharge. She's probably smelling like a fish from all the sweat. Postpartum mothers sweat a lot because that's the way baby recognizes the mother, right? Through smell, like I said. So you're probably smelling like a fish all the time. So they tend to have that, it happens.
That phase.
Yeah, but it's nothing to worry.
It's going to go away.
It's going to go away. Everything is going to go away.
Yeah.
It just depends on how you get through that phase.
Another question which says that how do I get my libido back, especially when I'm sleep deprived and leaky from everywhere?
So don't rush into it. Start off with the non-sexual intimacy parts. Then eventually, once you're physically healed well, once you feel like you're not in pain anymore, then eventually it will come back. So it is going to happen. And your partner should be understanding in this also. For some women, it might take just a couple of weeks. For some women, it might take months. There are even mothers who have not had sex for years after the child is born. Suddenly one day they'll realize, we actually didn't have sex for so many years. And if you ask the mother, she'll be like, I have been so busy taking care of the child.
Yeah.
So, but again, be mindful, work on it. It will happen. Take it slow, take it easy, feel good about yourself, it will happen.
One step at a time.
Yeah.
I don't have questions from the writers, but I have few fun questions to ask you.
Okay.
So the first one is, if you could write a brutally honest what to expect after your expecting guide, what would the chapter title be?
So there are many chapters in that part of life, right? So as soon as the baby is born, the first chapter would definitely be called Clueless Mama. Based on whatever we talked about right now, right? The women, probably first-time mothers, sometimes even second-time mothers, they are clueless. Suddenly the baby is in their hands. They don't know how to latch. They don't know if the baby is going to suckle. They don't when will my bleeding stop? Why do I still look pregnant? The belly is still there. So many things in it. They are absolutely clueless. They might have prepared. They might have read about certain things, how to do things. When it comes to doing it again, they're clueless. So those first few weeks, definitely that chapter would be called Clueless Mama.
Theory is different from practical.
Yeah. Then again, the phase changes, right? There are more chapters coming up. Yeah, it's just not. So then I think I would probably call that expect the unexpected. Because they're probably bleeding for longer than they would. They're probably taking longer than, they thought to get back into sex, or they're probably, their appetite is a lot different. Their digestion is a lot different. So everything is unexpected. Because they don't know what their new body is going to be like. So that phase would definitely be called expect the unexpected.
My second...
I want to add the next chapter.
Yes, I was actually waiting for that.
Yeah, the next chapter will be the fun one. Okay, I think I would call this, maybe once the mother gets the hang of all these things, she's doing everything, there's a proper rhythm that has established. I would call that the zombie phase. Maybe you would call that chapter Zombie Mama, because your clothes are dirty. You probably have milk spit up all over you. You don't remember when you washed your hair. Again, you're probably smelling like a fish. So, you're literally like a zombie. And you're mechanically doing things. You don't even sometimes apply your brain. Sometimes you're half asleep, but you're holding the baby, burping the baby, feeding the baby. Half asleep. So that's just proper zombie face.
My second question is, does being a gynecologist help you in your...
Sorry to interrupt.
Yes.
What are we going to call this book? So the chapters are okay. I feel mothers will relate to this. If I had to name this book something, right, or the title on the book, I would label it No One Gets It.
Absolutely.
Yeah,
that's a
that's a
good
nice
one.
title.
Yeah.
Exactly. No one will get it, guys. And Two reasons. One, the mother herself is not able to explain it right. She herself doesn't know how to put it in words what she's going through. And the people who are listening also may not understand all of it, even if she has expressed certain things. So no one will get it.
You should probably trademark this.
You should start writing
It's a
this.
good name.
Yeah, good name.
My second question is, does being a gynecologist help you in your journey of motherhood, especially in moments of panic?
Oh yeah, definitely. Definitely it helps because I think maybe I can share one personal experience here. So in my fourth month, right, I was a pregnant woman at the age of 39, and I had to go through all of those extra genetic tests and considering the elder age and everything. So I finished all of that within the first 3 months, and I thought, okay, I'm set now, I'm good. So baby is growing well. So I decided to take a trip in my fourth month. That trip was kind of planned before I became pregnant. So we decided to anyway go ahead with it. So I was on this flight to Japan and I suddenly start pouring, like bleeding.
Oh.
Bleeding like I'm drenched. That kind of bleeding. So I obviously thought I have miscarried. So that much bleeding usually don't see. So there I am in the flight. It was just 30 minutes into the flight. And I'm crying, and my husband doesn't know what to do. My non-doctor husband
Horrifying. It is
doesn't know what to
absolutely
do.
horrifying.
It's horrifying. Suddenly the pilot is asking me, we're going to, fly around because it's just been half an hour into the flight. We have another 6 hours to go. So that's when I was like, I'm like, no, I'm going to watch my bleeding. So I kind of laid down fully flat. Gravity helps to a certain extent. And I had the help of that head air hostess. So I was obviously not carrying sanitary pads. Why do you need sanitary pads when you're pregnant? That was a stupid thing of me to do, but I didn't carry. And my husband was going around the flight asking for sanitary pads, which is still funny. Now we talk about it. But that day it was scary. So I was talking to the air hostess. I asked her, do you have some, pads may not be enough in that heavy bleeding. Do you have some monitors? Can I check my own BP? Can I monitor my pulse? Because based on that, I can tell the pilot whether we should go back or whether we should go forward. I don't want to take that entire aircraft back, right? I would feel really bad. People would be cursing me. So, then she had a delivery kit in the flight. She showed me and, she gave me a pulse oximeter. So obviously, because it was me, because I'm a gynecologist, I know what to do. I know what is happening. I know when, with how much bleeding my pulse and BP will start falling and how I need to go about this. So it helped a lot, right? If it was some other woman in that situation,
Scary, man.
they would have
That's
totally
scary.
freaked. The flight would have quickly gone back. And even, going there, what did the air personnel do? Even after landing back in the airport, it would have been chaotic. It would have been tough for any other woman to handle this. So yes, being a gynecologist definitely helps me. I had a placenta previa, which is a low-lying placenta at the entrance of the womb, which I got to know later in the 5th month. You can't really see the placenta in the 3rd month and 4th. So that's what caused that bleeding. So it was all good. When I landed, I could tell them exactly what kind of doctor I want to go to. And again, in Japan, everything is in Japanese.
Yeah, I know.
Every single thing is Japanese. So I was on that Google Translate thing. My husband was like everywhere looking through the translator to translate to English. So there was a medical institute 1 hour from the airport. So we quickly went there. It was in the middle of the night. There was a resident doctor. There was no senior doctor. And she does my scan and she says, it's all gone.
Oh my God.
And the scan monitor was turning that side. She said, it's all gone. You have miscarried. I was like, can you please turn the monitor and show me? And now that girl also doesn't know English. So again, with the imagine what is going on in my mind and I'm doing this damn translating business. So she turns the monitor around. She's not even looking at my uterus. I said, please, can you show the uterus? She's doing a vaginal scan, so I can't do it myself. So I said, can you please show me the uterus? And she's just looking, and then, oh, there it is. So my baby was perfectly fine. I'm like, at this situation, this is the girl I had to get right now. So imagine if I wasn't a doctor.
I know.
That woman there would have thought I've miscarried and gone about her vacation trip, whatever, and, gone through so many things, probably cried the next,
I know.
month or so. So it helps a lot.
But this is an
Horrifying experience.
Yeah, it was horrifying. Yeah, my husband prayed to every god he knows. When we came back, we were like kind of going to temples for a while. So yeah.
He must have gone through a lot.
I'm so glad that
Yeah,
everything
he's not a
came back
doctor,
to
so he
normal.
kind of freaked out. But the first thing he said to me was, it's okay if you've miscarried as long as you're fine. We'll have another baby. But there are many who wouldn't understand that situation. My patients who miscarry, right? Then they come back and say, my husband is so disappointed, he's not talking to me.
Oh my.
So imagine what that does to that woman. So yeah.
Actually, abortion also has the same amount of hormones. They need the same care that comes to a new mom.
So imagine it's worse because you've lost a baby.
Yeah.
Here at least you have a baby. So it's something that's making you happy. So yeah.
You're given a megaphone and a captive audience of brand new parents. What's that one thing you wish every postpartum person heard loud and clear?
So to all new parents, right, this is one of the most beautiful journeys you'll go through. So enjoy it while it lasts. No matter how tough it's going, no matter how many hurdles you're facing, enjoy it while it lasts. You'll regret it later.
There's one last question. What's the most hilariously unexpected postpartum moment a patient has ever shared with you? You need not take the name of the patient, but
It's very rarely that we have, postpartum mothers talking about hilarious stuff. They're almost always stressed only. Doctor, how is this? Is this right? Is this wrong? So that's the kind of, body language we see when we see them postpartum. But hilarious experience, I would say there was one event where I think the mother had, infection in her wound and we were trying to do a dressing and all of that. Meanwhile, the baby was crying and the mother asked the father to change the diaper. So he goes in, there's a changing room in the hospital, goes there, changes the diaper and comes back. As soon as he comes back, we are done with the dressing and everything, they're just talking to me. The baby goes poo. Baby does potty in the diaper. So the father hadn't strapped it on well. So it just fell off the diaper with the weight of the poo, right? And there was poo all over his shirt. And then you should have seen his expression. So I'll never forget that.
All right. So I think that comes towards the end of the episode today. While motherhood, a lot of people, society, everywhere, movies talk about motherhood so much, postpartum is something that is conveniently left out. Postpartum is a phase where everything is stretched, everything is trying to come back to its normal place, and in between all of this, what goes on in a mother's mind, nobody knows. In fact, a lot of this episode today has been an eye-opener even to somebody like me, and I hope it becomes to people out there. The whole intention about us doing this podcast here is to bring in awareness so that more people understand what is going on with this particular phase in your life when it comes to postpartum, and even so for the parents and the grandparents also, when to give a advise, when to retract it back. So I think with that, we're going to close this episode for today. And don't forget to like, share, and subscribe, because spread the awareness. The more you spread, the better. And until then, thanks a lot, Dr. Manasa.
Thank you so much.
thank you so much, Manasa.
Thank you for having me.
Thank you.